Hi, my name is Shouse, and this is our MSN610 final assessment. All right, as I would come in the room, I would do hand hygiene with some alcohol and begin the assessment. Hi, my name is Sarah. I'm a nurse practitioner student at NKU, and I am here to do your assessment. How are you feeling today?
Really well.
All right, awesome. And what brings you in today?
I'm just finding a new practitioner and doing a baseline check.
All right, awesome. So just a little wellness visit, head-to-toe assessment. All right, great. And I see your name is Dawn. May I call you Dawn, or would you like to call me would you like me to call you something else?
You can call me Dawn.
Okay, great. All right, so Dawn, we're going to do just some silly questions just to assess how alert and oriented you are. So, Dawn, what's your date of birth?
1/30/84.
Awesome. And then what year is it currently?
2019.
And who's the president currently?
Donald Trump.
All right. And then what city are you in right now?
Alberton.
All right, awesome. So just here for a regular assessment, and I can see coming in, you're not in any kind of distress. Your appearance is appropriate, and your clothing and hygiene is appropriate for your age. So before I came in, my medical assistant got your vital signs, and I'll just let you know your blood pressure was 132/96, and that's a little on the high side. Do you have any issues with maybe some white coat syndrome?
Yeah, I get nervous going to the doctor.
Okay, great. When you usually take your blood pressure, it's
usually around 120/80.
Okay, great. All right, heart rate is 76, and then your respirations are 16 on room air, and your temperature was 98.4, which is awesome. All right, she also took your height and then your weight as well, and we'll just see where you fall on the BMI chart, okay? So we have a body mass index table here, and we'll just calculate what that is based on your height and weight. So your height is about 70 inches, and then weight is about 250 pounds. So that puts you at 36 on the BMI index. And so that does fall in the obese category. Are you doing anything with diet and exercise?
Yes, I've started exercising.
Okay,
yeah.
Excellent, awesome. Okay, so we'll move on. We'll just start with your head-to-toe assessment. So, I can see just from visual inspection that your skin tone is appropriate for your ethnicity. Just some scattered moles. It looks like none of them are abnormal upon visual inspection. No regular edges or elevated in height or anything like that. Okay, and then as I touch you, I see that your skin is pink, warm, and dry, so that's appropriate for temperature. So I'll just start with your scalp, Dawn. If you don't care to remove your glasses, just so I don't knock them off, and I'm just going to palpate your head, okay? So I'll go front to back, and what I'm looking for is any kind of tenderness. Just let me know if you feel anything.
No tenderness.
Okay, great. No lumps, masses, anything like that as well, okay? And then I'm going to actually pull your hair back and look at your actual scalp. We're making sure we don't have any kind of infestations or abnormalities with skin tone, any irregularities, anything like that. Okay. Get the back here. Okay. Awesome. Okay, now I'm just going to move on to your face, so keep your glasses off. We're just going to be looking at your jaw, okay? Kind of like when you're at the dentist, just checking for any grinding or rubbing. So I'm just going to press right here. I need you to clench your teeth. Excellent, and then open your mouth. Close again, great. So no clicks or grinding, popping when you do that, so that's normal. All right, and we'll inspect your sinus cavities as well. I'm going to start below your eyes and then go above, and just let me know if you have any kind of tenderness at all, okay? Excellent, awesome. Okay, and I can see just by visual inspection that your face is symmetrical. Give you a big grin, smell your teeth, great. No abnormalities, drooping on either side, anything like that, so it's good. All right, so we'll move on to your head. We'll see it's normal cephalic, which just means that it's regular shaped. It's not abnormal on any one side or the other. And we'll check out your eyes as well, okay? So before you came in as well, my assistant tested your visual acuity with your glasses on. That's corrected vision on your Snellen chart. And you passed with flying colors, 20/20 vision in each eye, and that's with your glasses on. So I'll just take my pen light here, keep your glasses off, okay? So what we're going to do is test your eye movement, and you'll just keep your head still, but follow my pen light with your eyes, okay? Great. All right, and we'll test your pupils as well, okay? So just stare straight ahead. I'm going to shine a light into each eye, okay? We'll do your right eye first. Great. Excellent. So movement's normal, and we also have pupils equal, round, and reactive to light and accommodation, so that's obviously normal as well. I'm going to take my ophthalmoscope, and we're going to look in your eyes, okay? So I'm just going to dim the light in the room a little bit here, okay? And I just want you to stare straight ahead into the distance, okay? And we'll check out your eyes. I'm going to do this left eye first, okay? Great. Okay, awesome. Excellent. And so that was normal. Optic discs looked normal. We've got the red reflex, and then no abnormalities with the vasculature in your eyes as well. Okay, so we'll move on to your ears, and I'm just going to palpate your ears. Let me know if you feel any kind of tenderness.
No tenderness.
Awesome. And I'm going to press down on the tragus. There you go. Great. Awesome. Any issues with hearing lately? Nope. Okay, so we'll just test that, and I'll whisper something in each ear. I want you to repeat it for me, okay?
Okay. All dogs are brown. Chickens are crazy.
Awesome. Okay, so what we'll do now is take a look inside your ears with our otoscope here, and I'm just going to be looking at your tympanic membrane, your eardrum, and making sure it just looks okay. It's not any kind of infection, no scarring, and then okay, we'll do the inside here. I'm going to kind of pull down on your ear. All right, it looks great. No abnormalities on that tympanic membrane. Right, and that one as well. It looks normal as well. Okay. All right, so we'll move on to your nose, and I see your nose is in line, no abnormalities that we can see visually. And I'll take my pen light, and if you'll just tilt your head upwards, I'm going to look up each nostril. Great. All right, so septum isn't deviated on either side. The nostrils are clear, and if you'll take and occlude one side of your nostril, breathe in. Great. Do the other one. No issues. Okay. Awesome. Okay, so we will move on to your mouth. Any issues with chewing, swallowing, anything lately? Okay, and you see your dentist regularly?
Yes.
Okay, awesome. All right, so we'll take our pen light again, open your mouth, and we're just looking inside, making sure you're pink, moist, hard palate's in line, no abnormalities. All right, soft palate's good. Also, the uvula is in line, no abnormalities. The tongue looks good. Okay. No cavities seen upon visual inspection. Okay, good.
No, I don't think
Okay. All right, so I'm just going to have you lift your tongue to the roof of your mouth. We're going to look under your tongue. Okay, good. No abnormalities there as well. All right, and then we're going to test the movement of your tongue. So I want you to stick it out, upwards, downwards, and then side to side for me, okay? Great, awesome. And then one more thing, I'm going to have you stick your tongue out as far as you can and just say ah for me.
Ah.
Great, and the uvula moves upwards, which is normal. All right, so we'll move on to your neck. Again, I'm going to palpate your neck. We'll do your thyroid as well. We'll palpate those glands, and then we're going to auscultate over your carotid arteries and then palpate those as well, okay? So we'll just go and start with your glands here. We're actually going to start up here and then kind of move downwards, okay? And then palpate the back, in the front of the neck. Okay, and while I'm in front here, I'm going to feel for your carotid pulse. All right, 2+ on that side. All right, 2+ on that side, great. And then I'm going to go to the back, okay, and I'll palpate your thyroid, okay. So just stare straight ahead for me. Move side to side here, and then swallow for me. Good, no issue swallowing. Okay, your thyroid is enlarged a little bit. Do you see an endocrinologist for that?
Mm-hmm.
Okay, yearly updates?
Yes.
Okay, great. All right. All right, so now I'm going to auscultate over your carotid arteries on each side, and then again over your thyroid, just to make sure we don't hear any kind of brewery, okay? Okay, so when I tell you, just take a deep breath in, out, and then hold it, okay?
Okay.
All right, go ahead. Good. Great. Good. Great. Okay, so no breweries heard, so no abnormalities right there. Awesome. And then no tenderness in your neck when I palpated any of those areas. Okay, great. All right, so we'll just move on to your lymph nodes. Again, we'll be palpating around your ears, behind your ears, down your neck, and then actually behind your clavicles as well. Okay, so, all right, so we've got some behind here. Here. Under your neck. Okay, great. If you could just shrug your shoulders real high for me. Okay, excellent. Okay, awesome. All right, so nothing enlarged or abnormalities there. And then with your shoulders, again, we'll just have, I'm going to lay my hands on your shoulders, and I want you to shrug up against resistance, okay? Okay, great, good. We're just checking some cranial nerves as well there, okay? Range of motion on your neck. I've been seeing you moving around, so it's no problem there. If you can, just tuck your chin and then look up to the sky. Great, and then ear to shoulder. Excellent. No pain when you do that?
No.
Great. All right. Okay. So now real quick, we're just going to lay back at a 45-degree angle, and what I'm looking for is JVD, which is jugular venous distension. Okay. So there. There's none present on that right side. Okay. And then none present on the left side. Okay, you can go ahead and swing your legs out from the side of the bed again. Excellent. Okay, we're going to move on to your chest and your lungs. So I'm just going to palpate the front and back of your chest and then listen to your lungs as well, okay? So just deep breaths in and out. If anytime you feel dizzy or need to stop, you just let me know, okay? Okay, we're going to start off palpation. Any pain or tenderness?
No.
Okay, excellent. And then we'll take a listen as well, okay? And again on this side. Excellent. I'm going to move around to the back side here and do the same thing. Move your hair to the side. Okay, any pain or tenderness with the palpation?
No.
Okay, awesome. Deep breath. Excellent. All right, so all lung fields are clear, anterior and posteriorly, so that's good. No issues with wheezing or anything like that. No, never had any asthma or any issues breathing. Okay, good. All right, so we'll move on to your heart next, and we're just going to listen over 4 spaces: aortic, pulmonic, tricuspid, and then mitral, okay? And we'll do that twice, okay? Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 1 Just going to flip my stethoscope over. Great. All right, so we heard S1, S2, that's the lub dub. No extra sounds, no S3 rubs, scallops, any kind of friction like that, okay? All right, so next, if you don't care to pull your pants up just a little bit to your knees there, I'm just checking for any kind of varicose veins. If we don't see any in either the arms or the legs, no evidence of vascular pulling, arterial or venous, so that's good. No issues with your legs walking, standing, sitting. Okay, great. All right, so I'm just going to check your pulse. So one at a time, your wrist, your radial pulse here. Great, and that's 2+, that's normal. 2+, normal again, and I'm going to get your pedal pulses, okay, right foot. 2+ and normal. All right, 2+, normal. All your pulses are normal and regular, okay. All right, so if you don't care to lay down, we're going to check out your abdomen here, okay, and raise your shirt up just under your breast area there. Okay, great. So upon visual inspection, we notice abdomen's not distended, so there's no abnormalities with any lumps or old scarring, anything like that, okay? So we're just going to palpate your abdomen. Just let me know if you find any tenderness, and then we'll do it again just a little bit harder, okay? So the abdomen is nice and soft, no tenderness. We're going to a little bit harder this time, okay? Good, so that's normal, no tenderness, and I'm just going to take a listen to make sure I hear some vowel sounds in there, okay? All right, and vowel sounds were heard in all 4 quadrants, so that's great. Go ahead and lower your shirt for me. All right, excellent. All right, now we're going to just test some range of motion on your arms and legs, okay? And we see that, you know, your muscle tone and your bulk and muscle tone distribution all looks normal upon visual inspection. No issues there. So we'll just have you raise your hands up all the way down, okay, and then out to the sides as well. Okay, and then one at a time, I'm going to ask you to raise these up. Good. And then we'll just count to 5. 1, 2, 3, 4, 5. Excellent. The next hand, please. 1, 2, 3, 4, 5. Awesome. Great. And then I'm just going to do some resistance. Try to raise up. Okay. And then up a little bit and push down. Okay. Great. All right. And we'll do the same thing with our legs as well. Okay. So if you don't care, just this leg up off the bed a little bit. 1, 2, 3, 4, 5. Excellent. And then this one. 1, 2, 3, 4, 5. Excellent. Great. Okay. And then one leg at a time. Move out and then back in. Okay. In. Great. And then pull up. Resistance. Great. And then lift them up just a little bit and then push down. Great. And we're going to do the same thing with our feet. Pull up. Push down. Excellent. Okay. And then we'll just take your knee and I want you to raise it to your chest as far as you can, each leg. Great. Awesome. And then we're going to do a little neurological test where we take the heel of one foot and we slide it up and down the shin of the other leg, okay? You can do both legs like that for me. Excellent. Awesome. All right, we'll test your reflexes again. This is the Babinski reflex, so I'm just going to rub the end of this up your foot. Good, that's normal. And it's normal to be a little ticklish, okay? And then we're going to check your reflexes as well, okay? Okay. There we go, that's normal. Okay, and I'm going to pull this up to your knee here. All right. Good. And again on this knee, okay? Good. Excellent. Okay. All right, any issues with numbness, tingling in any of your extremities at any time?
No.
Okay, great. All right. All right, so we can go ahead and swing your legs back down, and we'll finish out this exam with our neurological test. So I'll just have you stand up and back up over here in the corner. What I want you to do is heel to toe walk to the edge of this bed, and then do the same thing backwards. Good. Awesome. And then I'm just going to have you stand feet and arms together at your side. Close your eyes. Right, and we're just testing for stability. That's great. Awesome. All right, and we'll have you bend over and touch your toes if you can. All right, and we'll also look at your spine in line, no abnormalities. Okay, go ahead and bend up for me. And now I'm going to have you put your hands on your hips and from side to side. Excellent, good. All right, and then let's see. A couple more things to check here. We're just going to have you turn at your waist. All right, awesome. So any issues with your back or legs when you do any of those? Okay, great. All right. Let's see. Go ahead and take a seat back for me. Okay. Great. All right, so everything was pretty normal on your exam, except for your BMI, but it sounds like you're taking care of that with your diet and exercise. Also your thyroid, which you said you're getting your yearly visits with your endocrinologist. Do you have any issues or concerns that you want to discuss today?
No.
Okay, awesome. So you'll be clear to go, and then we just ask that come back in for your yearly next year, or if you have any issues or concerns, just let us know, and we'll be happy to take care of them. Okay?
Thank you.
You're welcome.